Hello everyone, I am Dr. Sukumar Sura, consultant spine surgeon. Today I am going to answer some of the most frequently asked questions about sciatica. Sciatica is a common problem that causes pain from your lower back down the leg. If you have ever felt a sharp shooting pain that travels down your leg, you know how disruptive it can be. The good news is that sciatica can often be treated without surgery. So let's go into the questions. What is sciatica? Sciatica is a pain that comes from irritation or compression of the sciatic nerve. The sciatic nerve is the longest nerve in the body, running from the lower spine through the buttock down the back of each leg. When something presses on this nerve, like a slip disc on your lower back, it causes classic shooting leg pain, which causes pain. Sciatica usually starts in the lower back or in the buttock and travels down the leg, sometimes to the calf or to the foot. It's a symptom of an underlying problem, especially the disc, or not a disease by itself. What causes sciatica? The most common cause is herniated or slip disc in the lower spine. This is when one of the soft discs between your vertebrae bulges out and presses on the nerve root, triggering pain along the sciatic nerve. Other causes include bone spurs or bone overgrowth, what we call it as in chronic spine disease, or spinal canal stenosis, where a narrowing of the spinal canal happens that can pinch the nerve. Even a sudden injury or strain to the lower back can lead to sciatica. Risk factors for sciatica include aging, as wear and tear of the spine over time, lifting heavy objects without proper technique, and prolonged sitting or sedentary lifestyle can cause sciatica. Sciatica is most common in people in their 30s and 40s, and obesity, pregnancy can also increase the risk by adding stress on the lower back. So what are the common symptoms of sciatica? Sciatica usually causes pain that radiates from the lower back or the buttock down the back of one of the leg. You might also feel tingling, pins and needles sensation or numbness in the part of the leg or foot. In severe cases, there can be muscle weakness in the leg. For example, difficulty lifting your foot, usually one of the side is affected. The pain often worsens with certain actions like sitting for a long time or with sudden movements such as standing up, coughing or sneezing. So these are the common symptoms of sciatica. How sciatica is treated? Most people with sciatica get better with simple conservative treatments. It's important to stay as active as you comfortably can. While a day or two of rest may help during a bad flare-up, prolonged bed rest is not recommended. Gentle movement helps you recover faster. Over-the-counter pain relievers like ibuprofen or naproxen can reduce inflammation and ease the pain. Applying heat or ice packs on the painful area can also help. Gentle stretching and exercise are the key parts of the treatment. Stretches for the hamstrings, hips, lower back, along with exercises to strengthen your core muscles can relieve pressure on the sciatic nerve. Physical therapy exercises to improve the posture and flexibility can be very useful. Also avoid heavy lifting or twisting your back while you are recovering. If needed, a doctor might prescribe muscle relaxants or special nerve pain medication for a short time. In some cases, an injection of a corticosteroid near the spine, what we call as epidural injection, is given to reduce inflammation around the irritated nerve. The goal is to control pain and improve mobility while your body heals. Do I need surgery for sciatica? For the vast majority of people, surgery is not needed. We consider surgery only if the pain is extremely severe, not improving after several weeks of proper conservative treatment, or if you have serious symptoms, then surgery is required. Serious symptoms include things like significant weakness, for example, if you can't lift your foot, or any loss of bladder or bowel control which is very late. This could mean the nerve is under a lot of pressure and might need urgent surgical intervention. If a large disc herniation is improving with conservative care, then surgery can remove the portion of the disc that is pressing on the nerve to give relief. This kind of operation is generally safe and effective. However, because any surgery has some risk, we use it as a last resort. In summary, we try medication, physiotherapy and possibly injection first. Surgery is considered only when absolutely necessary to relieve pressure on the nerve to prevent permanent damage. Will sciatica go away on its own? How long does a recovery take? In many cases, sciatica does improve with time and conservative care helps. Most people start to feel better within few weeks. Some mild cases even resolve in a couple of weeks, while more severe cases could take few months to fully heal. The key is to be patient and stick with your treatment plan of exercises and precautions. If your sciatica isn't improving at all after 4 to 6 weeks of conservative treatment, check back with your doctor. You might need to adjust your treatment or do further tests like MRI. And remember, if you experience new or worsening numbness or significant weakness or any other issues with the bladder and bowel control, seek medical attention immediately. Those signs might require prompt treatment. Generally though, with time, the proper care, most people recover and get back to their normal routines. How can I prevent sciatica or stop it from coming back? To prevent sciatica from returning or recurring, focus on keeping your back and body healthy. Regular exercise is crucial, especially exercise that strengthen your core muscles, that is the muscles of the abdomen and the back, are very important, and improve your flexibility. Activities like yoga or simple stretches for your lower back, hips, legs that can help keep pressure off the sciatic nerve most of the times. Pay attention to your posture while sitting. Use a chair with a good back support and avoid slouching. If you sit a lot, take breaks to stand up and stretch. When lifting objects, always lift with your legs, bend your knees and keep your back straight instead of bending your waist. So maintaining a healthy weight will also reduce the strain on your spine. In general, staying active, using proper body mechanics and avoiding unnecessary strain on your back will greatly reduce the chance of sciatica coming back. What are the advancements in disc surgery today? When all methods fail, like you started medicine, started rest, physical therapy, pain management, and still your pain is not coming down, and a doctor has decided surgery for your disc problem, which is causing sciatica. The latest advances in spine surgery is endoscopic spine surgery. So the endoscope, which you can see here, it's a small tube which go from the back without disrupting the muscles, without damaging the bone and the nerves. We can safely remove this offending agent, the disc material, without causing much collateral damage today, and relieve the pain immediately. The patient goes back on the same day or the next day within 24 hours. This is a major boost to patients suffering from back pain and leg pain and sciatica, where we can relieve their symptoms with this advanced technology and relieve their pain and restore their function immediately. Maintaining a healthy weight will also reduce strain on your spine. In general, staying active, using proper body mechanics and avoiding unnecessary strain on your back will greatly reduce the chance of sciatica coming back or from recurrence. I hope these answers have helped you understand sciatica better. Thank you for watching.